What's the connection between Prader-Willi syndrome and sleep apnea? Have you ever wondered how certain genetic conditions can impact sleep? Today, we are discussing the connection between Prader-Willi syndrome and sleep apnea. Prader-Willi syndrome is a genetic disorder that significantly raises the risk of sleep apnea. This condition can manifest as both central sleep apnea and obstructive sleep apnea. The link between Prader-Willi syndrome and sleep apnea stems from various physiological and neurological factors. One major issue in Prader-Willi syndrome is hypothalamic dysfunction. This affects how the body regulates breathing during sleep. Additionally, individuals with this syndrome often experience muscle hypotonia, which means they have reduced muscle tone. This can make it harder for them to breathe properly while they sleep. In infants with Prader-Willi syndrome, central sleep apnea is common. This occurs when the brain temporarily stops sending signals to breathe. Unfortunately, this can continue even as they grow older. As children with Prader-Willi syndrome develop, they often face obstructive sleep apnea. This type of sleep apnea is characterized by repeated blockages of the airway during sleep. Contributing factors include muscle weakness, obesity, and enlarged tonsils or adenoids. The prevalence of obstructive sleep apnea in children with Prader-Willi syndrome is striking. Estimates suggest that up to 80% of these children are affected, compared to only 2 to 3% in the general population. Another challenge is nocturnal hypoventilation. This occurs when breathing is insufficient, leading to low oxygen levels at night. This can happen even if there are no clear apnea episodes. Such conditions can strain the heart and increase cardiovascular risks during sleep. Growth hormone therapy is often used to help improve growth and body composition in individuals with Prader-Willi syndrome. However, this therapy can also influence the risk of sleep apnea. While generally safe, it may worsen obstructive sleep apnea in some cases. This is due to its effects on tonsillar tissue or airway structure, making careful monitoring essential. Beyond breathing issues, many individuals with Prader-Willi syndrome experience excessive daytime sleepiness and symptoms similar to narcolepsy. These symptoms can persist even after addressing sleep apnea, indicating that the neurological aspects of Prader-Willi syndrome affect sleep regulation. From a practical viewpoint, early screening for sleep apnea in individuals with Prader-Willi syndrome is vital. Diagnosis often involves overnight sleep studies, known as polysomnography, to determine the type and severity of sleep apnea. Treatment options may include adenodenselectomy, positive airway pressure devices, and careful management of growth hormone therapy. However, it is important to note that adenodenselectomy may not completely resolve obstructive sleep apnea in every case and can sometimes lead to complications. The connection between Prader-Willi syndrome and sleep apnea is strong and involves both central and obstructive breathing disorders. These issues arise from neurological and anatomical factors related to the syndrome. Effective management requires early detection, tailored treatment, and continuous monitoring to improve sleep quality and overall health for those affected.